Welcome, everyone. We will be getting started shortly.
Good evening, everyone.
Okay, I think I let everyone in from the chat. So I'll just start off and then I'll pass it over to our president. I am Nicole Kamack. I am chair of the Journey to Wellness Committee, and I want to welcome you all tonight to Black Health Matters, Advancing Wellness in Our Community. Tonight we have a dynamic panel ready for you all where we will discuss advancing health and wellness. And so I want to pass it over. We will do our emergency preparedness and welcomes, and then we'll jump into the panel discussion for tonight.
Thank you, SOAR, Dr. Kamak. This is Dr. Scabella Hill. I am the second vice president of the chapter and welcome you all to this evening's event. I just want to give you a few reminders for our emergency response and your safety. In any location in which we conduct Delta business, we always are Delta ready. Please take the moment to identify 2 exits in your current location in the event that you need to evacuate emergently. Please be safe as you do that evacuation, and please be Delta ready. I will be turning this back over to SOAR, Dr. Kamak.
And thank you for that. And now I'll turn it over to our president of the Washington, D.C. Alumni Chapter of Delta Sigma Theta Sorority Incorporated. Nicole Jordan will open us up with a welcome. And thank you for joining us tonight.
Thank you. So, good evening to my SOARs and good evening, everyone. I am Nicole Jordan, and I have the pleasure of serving as the president of the Washington, D.C. Alumni Chapter. And it is truly my honor to welcome you to this powerful and necessary conversation. We don't take it lightly that you took time today in this really hot day to join us for this conversation. So tonight is more than health. It's about our life. It's about our dignity. It's about our right to not just survive, but to thrive. Black health continues to be a critical public health priority, and we see these disparities. We know the statistics, but beyond the numbers are real people with families and real stories, stories of resilience, but stories that remind us that there's still more work to be done. And that's why tonight matters. The Washington, D.C. Alumni Chapter, we have been really intentional about creating spaces for this continued conversation. We work hard to ensure these discussions don't just happen once or we do a program and we just walk away, but that we continue this. And we do this because it's important. It's too urgent, it's too personal to be a one-time dialogue. Our commitment is to keep the conversations going and turn that conversation into action in our community. So tonight we bring together voices from our medical, mental health, public health, community advocacy, not to just talk about the challenges, but to shine light on what is possible, to explore how culturally grounded care, prevention, and thoughtful policy can transform outcomes and create a future where our communities are healthier, stronger, and fully seen. So I really want to just thank and take a moment to thank this incredible panelists for taking their time and sharing their gifts and talents to this committee under the chairs, under the leadership of SOAR Nicole Kamak and Dr. Nicole K-Mack, and Dr. Naya Relaford. Thank you for the work that you've been doing and your commitment, and Dr. Erica Scavella-Hill for leading this group as well. So tonight, I just everyone to be here, lean in, listen, ask questions. This is just a big conversation with your family. So we really hope that you enjoy this, and more importantly, we hope that you take something that you've learned back to your community. So with that, I'm going to give it back to Dr. Taylarr K-Mack. Too many words. Too many words. Thank you.
Thank you for that amazing intro and welcome. So I am going to jump in. We have our panelists are very, as we've mentioned, they are dynamic. They have great, incredible, and diverse backgrounds. And so I'm not going to read their full bios because we want to be mindful of time, but I do want to introduce the people before you. So that you know who is here today. So first, I will start with Dr. Lillian Walker Shelton. She is originally from Philadelphia, Pennsylvania, and she has traveled as a member of women's delegations to Central America and the Caribbean. Her writing and research has strongly been influenced by the different people that she met along the way. She teaches classes at Trinity Washington University and Marymount University. Lillian has a doctoral degree in counselor education and supervision. So welcome. Next up, we have Taylarr Lopez. She is an award-winning public health communications leader with over a decade of experience in strategic marketing, health advocacy, and health literacy. She serves as Health Communications Director at the National Minority Quality Forum, where she leads the Lift Every Voice program to amplify patient voices and advance equitable health education in underserved communities. Welcome. Next, we have Dr. Monica Ponder. She is an assistant professor of health communication and culture in the Department of Communication, Culture, and Media Studies within the Kathy Hughes School of Communications at Howard University. Dr. Ponder's research examines organization-level approaches to public health and crisis communication practice, particularly those centering a radical Black feminist lens. She serves as a faculty fellow at the Georgetown Howard Center for Medical Humanities and Health Justice, and as an inaugural faculty fellow with the Alan Alda Center for Communicating Science at Stony Brook University. Thank you so much and welcome. And then lastly, we have Dr. Neosho Ponder. She symbolizes perseverance, strength, and resilience. In 2016, 1 year after graduating from Howard University with a Ph.D. in communication, culture, and media studies, her life took a sharp turn when she discovered a lump in her left breast. By recounting the hardships of unexpected homelessness, chemo treatment, surgical complications, losing loved ones, and the day-to-day journey through cancer, Neosho explores how the intersection of her faith in God, resilience, and humor saved her in her first book, God's Got Jokes. Welcome to our panelists, and I thank you all for showing up here tonight. And I want to just kick this off, and for this first question, we'll just open it up to the panelists more generally, whoever is available to answer the question, just jump on in. So as we're thinking about Black health matters and advancing wellness in our communities, we want to think about where we are now, just sort of setting the context of where we are today. What would you say are the biggest barriers to accessing quality healthcare in Black communities today, and how can we address them?
I can take that first one if you don't mind. First, I want to thank you all for allowing me to sit on this panel and speak with you all this evening. I really appreciate it. I do hope that whatever I share this evening, you all find it insightful and resourceful. But to answer your question, to be honest, I think that the barriers are layered. It's not just one thing. We're talking about structural issues, so like access to insurance, transportation, and provider shortages in certain communities. And if you live in Prince George's County, you know that provider shortages are a huge thing. But just as important are trust barriers. Many Black patients I constantly hear when I do like focus groups, workshops, patient education sessions, one of the biggest themes in those sessions is that they feel dismissed or unheard or misunderstood in healthcare settings. So there's like this huge information gap. And if the health information isn't clear or culturally relevant or easy to act on, then people are pretty much left um, navigating like really complex decisions without the tools that they need. So I would say to address this, we really have to take a multi-pronged approach. So that can mean investing in community-based care models or expanding access points beyond just our traditional clinical settings, and really making sure that providers are trained in culturally responsive care. A few weeks ago, I hosted a webinar on shared decision making um, among healthcare providers and cancer patients. And one of the biggest things that came out of that is that providers just they have time constraints when they're dealing with their patients, as well as like an overwhelmed health system. So shared decision making, is something that seems to be a barrier because when their providers aren't practicing that in a clinical setting. So that's something that providers need to be educated on, especially, but also their healthcare system needs to work with them to kind of get past those time constraints. So access isn't just about proximity. I think it's about whether people feel seen and heard and supported when they get there.
Dr. Ponder, I see you want to add something to that.
So Taylarr gave some tactics, and I just want to first of all say thank you so much, Soros, for inviting me. I want to bring honor to my mother. She is a soror of 53 years. She passed today 3 years ago. Today is also my 26th Delta anniversary, so a very special time to be here. I want to honor Dr. Bailey, Moya Bailey, who coined the term misogynoir. And what I think is, I know we're talking about health here, but Black women are just disrespected in this country, period. And so I'm going to center it on women because I think when Black women win and we're healed, everyone wins. And so we're hyper visible and invisible, which is what Dr. Bailey said. And so in all the ways that Taylarr brought up, it 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 is evident in many areas across the spectrum of healthcare, right? So the literacy, the way we are spoken to, the way we're dismissed, right? The way we're disrespected, the way our bodies are entitled to. And so when you look at the cultural status of Black women, the many of us who are resting for obvious reasons, as well as still working and being weathered, culturally, if that's not fixed, the tactics will never ever work. So I want to say that too, just to set the stage that Black women themselves are just in a very precarious place in this country. And so anything we talk about today will have to be situated within that context.
Thank you for redirecting, Dr. Ponder. Oh, we have two Dr. Ponders. Neosho, did you want to add something as well?
Yeah, thanks for you can call me just Neosha, it's fine. And I go through this at Howard because I sometimes teach there, so they always ask are we related. I'm like, no, not that I know of. So hello, Sora, Dr. Ponder. I appreciate the invitation from Sora K-Mac. I am going to put in the chat. I am a breast cancer advocate as well with the Tiger Lily Foundation, amongst other organizations. But Tiger Lily has like it's a lot, just so you know. And I've had them all printed in my home in boxes before. Okay, so but they have barrier toolkits that like a plethora of research has been done around different types of barriers to access to like breast cancer research and breast cancer treatment, but also just healthcare overall. And it's not only for patients, it's also for practitioners. And I really like the toolkits because they have different ones for different things like stress, like socioeconomics, like environmental, all these different barriers that exist to access to healthcare, not just breast cancer, but because Tiger Lily is a breast cancer organization. But I just put that in the chat for people. If you want to download it, they're free. And if you need more information, of course, contact me or shoot them an email. But I like those toolkits because again, it breaks it down into individual types of barriers and not just you know color and race, but also media portrayals is also part of the toolkits. And as someone who studied media, I appreciated them pointing out, that when you don't see yourself in an ad or on a TV show about health or something, you may not believe that you have the words or the confidence to speak up on your own behalf. So check those out.
And thank you for bringing that up. I'm a psychologist and I was talking to someone today, and one of the things that he mentioned is it took me so long to get help because no one ever said to me, you should get help. These are ways that you can get help. He didn't see people in the environment that he was in
Mhm.
getting help and didn't have people sort of advocating for him to go that route. And so we know that portrayal, like how we look, who's telling the story, who that is a part of healthcare as well. So
Mhm.
how do narratives shape how Black communities understand health, illness, and care? Like, is it, like what messaging and how does that influence some of our trust and engagement as well when we think about, medical treatment?
Well, if I can start, I think that, part of the narrative that I have seen very much is that, going to the doctor is this thing that's so very expensive and it's just hard for us to access it that way. And I hear so many people say that, or the other thing that I hear from people, the other narrative I hear from people is that, well, I don't want to go to the doctor because they always tell you something wrong. And it's like, do they always tell you something wrong? So, this narrative about it being expensive and what the doctor is going to say is something that is really prevalent. But kind of tying it in back to what, Taylarr and both Dr. Ponders were saying, also too, like, the narrative of understanding, I think is very important. Neosha, I also am like a breast cancer survivor. Actually, I'm still in treatment for my breast cancer now and
Oh.
everything like that. I'm very familiar with the Tiger Lily Foundation. And, I had a friend who is Caucasian, who's from the West Coast. She lives in the Bay Area, go to the doctor with me recently. And my primary care doctor is actually one of your sorors. She's an African American woman. And, and I know her. She's great. And, everyone in the office was African American and everything like that. And when we left, my friend who is Caucasian said to me, this is so different than what would have happened to me in the Bay Area. And I was like, what do you mean? And she's like, you see how everyone in this office is Black? Like, this would not
Mhm.
have happened, for me. And, so it is something that, like, that we living in this area can just, we fully can take advantage of. All of my doctors are women and women of color. So even for me as a mental health therapist, I can't explain to you how comfortable that makes me feel just going to the doctor and being able to have that access, so like, I think that that goes back to the whole narrative thing of like, what does it even mean? What story am I even telling myself before I even
Mhm.
get in the door of the doctor's office?
Yeah,
So,
as a young woman, I was diagnosed at 36, and I really didn't see a lot of media images of young women with breast cancer, young professional women with breast cancer in media, be it a television show and whatnot. And I didn't start seeing it until I was already in treatment and studying portrayals, media portrayals for my master's and PhD at Howard. I found that quite baffling to me, right? And the but not just media portrayals, but like Dr. Shelton said, when you go into an office and being a national lead, angel lead for Tiger Lily, I advocate all over the country and they've sent me all over the place. And to hear the stories of young women and women of color of how they've been treated by their medical providers, how they've been dismissed. I was almost dismissed. Like if I was not a professor at the time, an adjunct professor at Howard when I was diagnosed, and they spoke to me like such, I don't know if the doctor would have let me get a mammogram. And my tumor was very pronounced. He's officially Black History, almost 10 years, just so you know. But I don't think that we give enough attention to um the ageism in healthcare, especially for young people. We talk about it with older people all the time because I had to find my dad a doctor and then he ended up being diagnosed with prostate cancer. Thank God it was early stage, and it was a Black doctor in Kansas City, by the way. But he didn't want to go to the doctor because he didn't feel like he was being heard. And he was in his 70s when he was diagnosed with prostate cancer. So that's something else that, I don't think that, I don't see it enough. And maybe Sora Monica can speak to research being done around ageism in healthcare. But I just wish that we would have more of these kind of conversations that included that as well.
Yeah, I think what you're saying, Nyosha. So it's to Dr. Ponder. So Dr. Ponder, Nyosha. I look at it from a crisis comm standpoint, and the social stigma that comes with Black women not being well or being weathered or being the mammy or being the mule. And so it is heartbreaking to me that we only see Black women sometimes at the point of crisis of death, or something has happened, right? And so now we're talking, now we're sharing, now we're interested. I worked at CDC, and I don't know if you guys remember Shalon Irving, 36-year-old mother, double Ph.D. She passed away 2 weeks after giving birth. And so class, and I think, Neosho, you're bringing up age, it doesn't protect us, right? And so media perpetuates these tropes that we are invisible until they can't ignore it anymore. And usually it is at the point of death or when we're actually in a very vulnerable position. And I think the only way we can really fight back as a community, and this is where we're going to call in the Black men and call in the children and call in, is to have our safe spaces at our kitchen tables and our living rooms where we can make sense of things and love on each other and care on each other and be our own advocates, because media is why most people don't respect us and see us as that strong person, that person you go to if your child is lost, you tell them go find a Black woman. It's because it's the media that has these tropes. And so, I mean, I wish I would have come prepared here to name all these beautiful Black women that are in the media, from maternal health to being killed by their boyfriends to it's just the news cycle is depressing. It's depressing. And so, of course, when you go into a doctor's office, you almost have to defend yourself from that angle, and that is in itself stressful, right? And so what does that mean? And right, it weathers us. And so, I am actively thinking about this in terms of how do we fix this. And I think the theme of this, Nicole, with the journey to wellness, is because the conversation, the solutions start here with us gathering. This is what we've always done. This is what mutual aid is, right? And so there are probably people on this call with stories. Name it. My thing now is to name it. Name it. Someone harmed you, name it. Right. And so I think this is a part of how we fight back with our own stories, our own narratives. Right. So I love the colleagues here who are like, no, I had this happen to me. This is what happened to me, because guess what? That word is going to bless someone else. And this is our power. And this is how Black folk have always kept ourselves together in the history of this nation, is through that type of work. And so it's the narratives that are also propagandized against us. I don't want to see another Black woman body that we could have protected before a news cycle that is now sensationalized for clicks. So you guys see, I'm very passionate about this because it's every day. I don't know if you guys have paid attention or noticed it. It's every day a Black woman has been harmed.
Yes, and just looking at the chat, as you said, name it. There are people sharing their stories where they were either young or they didn't feel heard. Someone didn't listen to them. They had to go through multiple providers before even getting a diagnosis. What do we do with that? Because that is a part of like the stress and the burden that people are carrying too, even when you're trying to get help and feeling like you're not being seen or heard. And, we do live in an area where if you want all of your medical providers to be Black, they can be. But then for some people, they're in areas where that may not be possible. So what are some ways that people can start to advocate and prepare themselves for their medical providers and or in searching for a medical provider?
I would say, sorry.
Go ahead, Taylarr.
This is an excellent question. One of the main things in my job with the National Minority Equality Forum through the Let There Be Voice initiative is collecting patient stories. And that is across just a gambit of different disease topics. When I'm out in community, when I'm doing these focus groups, workshops, these events, tabling, wherever, it's usually at some sort of health focused event. And so while there, I'm talking to people, I'm talking to different patients, trying to collect their story, whether it's lupus or breast cancer or, Alzheimer's, whatever it is. I'm interested in collecting their patient story. One, not only to know the experiences of what they're going through, but we collect these patient stories to initially advocate on Capitol Hill. So, when we do these meetings on Capitol Hill, we're meeting with different Congress members and representatives to either get some sort of bill passed or to bring additional awareness to the issue. And in addition to that, we're using these patient stories to build these peer-to-peer networks. Because what we now know as researchers is that, peer-to-peer networks is one of the most effective ways of people learning more about their condition, getting resources, and actually being active and doing something about their condition. Before the webinar is over, I'm going to put a link in the chat to where either you can contact me directly or share your patient story, because I'm constantly trying to reach out and find patients to, collect and share their patient story. But, as far as trying to find a provider, one that, you'll be comfortable with and one that you feel will listen to you, it is so, so, so important to do as much research as you can. I know in 2023, when I got pregnant with my first child, it was very difficult trying to find, a provider within my vicinity, within my zip code that I felt comfortable with, that I knew was going to provide quality care. And that's really unfortunate because I love my county. I love where I live. I love my county. I love my community. I love the people of my community. But unfortunately, I had to go outside of my county to get quality care, and just doing a lot of research, talking to my peers, like, where do you go? What doctor do you use? How did they treat you and things like that? What kind of interventions, do they provide? And just things like that. It's really sharing those stories with each other and networking with each other is when you really begin to discover and learn what's out there and where that quality care is.
So Taylarr, do you mind sharing where you're from? Or where,
Yes,
where you?
I live in Prince George's County.
Prince George's. Okay. I'm going to be honest. One of the best ways is that we have to hold institutions accountable, right? And so we have these individual stories that we're navigating through. Not always harmful. Sometimes they're beautiful. Sometimes we've made it work and we've made it through and it becomes a testimony. But what we know in crisis comm is the way that you get it done is two ways. And I'm going to say three. One is media. We have to tell our stories, but also in a mediated way. So that's why you see a lot more influencers. People have gone through something and now they're on social media sharing their story. They've connected. They've become their own advocates. You also have, I'm going to put a couple of links to examples in the chat. I'm from South Georgia, Albany. I say my people did not migrate north, right? And so ProPublica just did a story on that corporate hospital. It's a white hospital from Jim Crow, and COVID hit that town hard. But the beautiful stories that came out. Media is the way that you affect reputation. And now that hospital now is doing community listening sessions and, trying to build that image, but you have to go that way. And we have to also collectively gather the stories. I think you were saying, Dr. Ponder, that you're building the database of the stories, that is it, right? And I would say the third thing is arts. Sometimes we can't, sometimes it's so painful. The best we can do is create, sing, right? And we communicate in different ways, which is also a part of the Black tradition. And so I advocate on that side of it. And then, of course, that interpersonal is that way that we know. If something happens, talk to people you trust about it, right? It's okay to write a letter. I had to move my mom from the hospital in Albany to a teaching hospital in Georgia. And if anybody else, I'm going to say this as a professor, if you have anyone you love, send them to a teaching hospital. Right. And I wrote a letter to the CEO. Thank you for saving my mother. I said, look, she's probably depressed. She's 70. She's lost her mobility. Look at her. Listen to her. Right. And so the stories, advocate for yourself. But guess what? We learn because of spaces like this. Right. And so I'm going to always make space for people to share their stories. But also we must hold institutions accountable for harming us. And so what does that look like for you and what you've gone through? Name it.
I think I spoke to that about my dad. him not feeling like his doctor, he's in Kansas City, Missouri. He's had white doctors probably majority of his life. And my mom, I get on my parents because they used to like share diabetes medication. I used to be like, y'all ain't in no nursing home. Why y'all sharing medication? Like, I don't understand. And then my mom was like, he doesn't want to go to the doctor. What? I don't like, and she knew something was wrong in terms of, her being his wife. And so I called my dad, and mind you, I called him just on his phone in the next room, and I said, you know, you're not going to the doctor. When the last time you've been to the doctor? And he was like, probably a couple years ago. Tell me about what happened. And this is what I talked to breast cancer survivors. I talked to them just like this, like, what was said? How did you feel when you left? What do you need? Would you like a doctor of color? Yeah, that'd be great if I could have one. Would you like a male doctor? Oh, yeah, that'd be great. And I'm over here like, because I am very resourceful. If you don't know me, I know a lot about a lot for no reason. I said, say less. I called up my friend who is an internal medicine doctor in Kansas City, Morehouse alum, Mizzou alum. And I said, do you have any openings for new geriatric patients? My dad hasn't been a doctor in 2 years. Within like 3 months, my friend, Dr. Aaron Ellison in Kansas City, Missouri, told my dad that he needs to go see a urologist because his numbers were borderline. I was shocked. My dad was diagnosed with prostate cancer. And if my dad had seen a doctor that didn't look like him, I think they would have said come back in 6 months. And there's so many breast cancer survivors who are triple negative. Triple negative breast cancer is like throwing spaghetti at the wall and hoping something sticks. There's no treatment. There's no direct treatment plan, right? I would, I just, it's so sad that when you wait and then the cancer grows and then they want to be also proactive, and that's what gets me. And we hear these stories repeatedly in our community. It's not just women, it's not just Black men, it's children, it's our elders. It's just so unfortunate. So I hope that in this conversation, those action items that we talked about and things like that, if a doctor's not listening to you, find a new doctor. I had a whole housing community in Southeast DC at a back to school rally one year saying find a new doctor, everybody together. Like if your doctor doesn't want to send you to get a mammogram and you have a lump, find a new doctor. If your doctor is dismissing you, doesn't want to listen to you, rushing you, find a new doctor. I know they don't have a lot of time, but I have a white doctor at GW that still makes time when I have extra questions. So it's not just the people of color that listen, because like someone said in the chat, all your skin folk ain't your kinfolk. So find a new doctor. At the end of the day, you want doctors who are compassionate, who are knowledgeable, who don't think they know everything, and who doesn't mind asking questions. My oncologist is a Sikh. He is Indian. I barely understand what he's saying sometimes, but he's been my oncologist for 10 years. And he don't mind repeating himself. He don't mind showing me the data. So all I'm saying is that's a marching order for everybody. If a doctor's not listening to you, or if you don't feel comfortable, find a new doctor.
Thank you for that. And, I guess part of it is like advocacy for ourselves, is having these types of conversations to where we can normalize things, or we could talk about who do you go to? What does your doctor do? Because sometimes we don't even know what we don't know. And a big piece of all of this is holding the institutions accountable. We know that through media, social media, we've seen it time and time again where people tear their stories and it gets, some traction. Then we get some change that comes from that, even though a part of it is like it shouldn't have to come to that, but we do have to think about this in all the ways as we're advocating for our health and wellness. Dr. Shelton, I see you have your hand up. Is there something you would like to add?
Well, I kind of want to add, and Lauren brought it up in the chat there, Lauren Russell, that, I have a phrase when going to the doctor, 4 ears is better than 2 ears. So if you can bring someone with you who will ask questions, please do that. My brother is an oncologist. He doesn't live here locally. He lives in Chicago. And when I was going first through my treatment and through my diagnosis, my brother asked me, who's going to the doctor with you? Who's going with you? And, my friends would go with me, sometimes coworkers, some people who, like, I was taking a class at the time, some of my fellow, like, students would go with me, and they all knew they all had to take notes and they had to report these notes to my brother. So, it was like, all right. But not everybody has a brother who's an oncologist who's checking their notes. But that's what I would say, when you, especially for these appointments where you may be a little anxious and you may be a little nervous, take somebody else with you, who can help you and also ask questions. I've seen that different in different settings before. Sometimes, they have like actual clinical case managers in DC who work with people who have like mental health, and they will go with them to the doctor and go with them to appointments and ask questions. So, and this can be really very helpful. But, I think also too, what I have heard from people over the years is that, well, I'm afraid to ask the doctor a question because they're the doctor. Well, bring someone with you who's not afraid to ask the doctor a question. Bring someone with you who will speak up for you. Because ultimately, this is your life, and this is something the best advocate for you is you. But if you can't bring like just yourself, bring the second best advocate with you too, as a family or a friend or someone else with you. So that's what I would just also like to mention.
I want to mention this one last thing to this question. If you can, try and find a doctor who takes your personal life into consideration. One who considers your religion, one who knows that you have children. Sorry if you hear my dog barking in the back, it's very, very annoying. One who knows that you have children, one who knows what your hobby is. If they are prescribing a therapy or a drug, um, see if they'll consider that. So like, let's say if you like swimming or hiking or something, are they going to take into consideration what prescription or what they prescribe to you so that you can still do those hobbies? It's very important. And again, this goes back to the whole shared decision making thing. When your doctor knows your personal life, and if they are a good doctor, they're going to take those things into consideration to make sure that you can continue to have a good quality of life. There are way too many doctors who are just quick to prescribe, here, take this medication, let me know how you feel later. But a really good doctor are going to take into consideration your personal life and the things that you enjoy and the things that you want to continue to do, and try and work those treatments or therapies around that. So it's something to keep in mind.
Yeah, so I hope you all are taking notes, because part of what we're talking about is we're coming together to talk to each other. We're sharing resources. We're also bringing people to those appointments with us. And a lot of times that can be helpful, whether it's taking notes, it may hold the doctor accountable, but also if you're feeling overwhelmed in the room, you don't have to worry about processing what the doctor is saying and understanding and remembering everything, because you have someone there to advocate for and take notes and ask questions as you need. And I do want to put up a reminder, like if you have any questions, please add them to the chat, because we will have some time at the end to come to those questions as well. And I want to shift a little bit, because some of this is overlapping as we think about mental health and wellness, even the anxiety that someone feels around going to a provider or an appointment, but then also thinking about that connection between our mental health and our physical health. So I want to open this up to Dr. Shelton. When we think about our health, what are some of those signs that someone's mental health may be impacting their physical health, or vice versa? Because even in the chat, someone said a doctor told them it was just stress, which can feel like it's minimizing to what someone may actually have. But just if you can give us any insight around the connection between mental health and our physical health.
Yeah, I mean, I think there is such a big and a broad connection. I recently went to the Grounded bookstore and coffee shop. Have you guys ever been there before? Down on Martin Luther King Avenue in Southeast DC. It's like wonderful. It's a really great place. Like even when I went in there, it just feels absolutely great. But I went there for a book talk, and it's been like about 2 or 3 weeks now. But this African American woman was giving a book talk on her book called Less is Liberation. And her name is Christine Platt. And in the book talk, she was talking about how she wrote this book, and she is an attorney, and she hadn't been feeling well, but she still had been operating. And she went to the doctor. And when she went to, like, I think it was like maybe even just an urgent care or something like that, the people there checked her out and everything, but they were flitting all about. They were just talking to other people. There was like a kind of a commotion. And she later explained, like, the commotion was because they were trying to figure out, like, should they send her directly to the hospital or should they give her medication? Because her blood pressure was so high that, she was borderline to having a heart attack. But for her, she said this is how she always felt. This was the level and the basis for what she was operating at, and so she's operating at like pre-heart attack level, and I think that's how it is for so many of us. We're used to, like, we say, oh, we work well under pressure, or we work well under stress, it, at least once a week somebody tells me I'm a strong Black woman. I mean, and I hear all this, but it's just like, how is this really helping our health and really, really helping us even be aware and giving us signals to symptoms that something may be wrong? So many of us, we don't know until the heart attack actually happens. And just as I wrap up in what I'm saying, I think two things that I often really pay attention to with people is when I ask them about how are you sleeping and how are you eating. These are two basic things. And Christine Platt in her book talk talked about how these are two basic things that she, because she was operating at this pre-heart attack level, was just even neglecting. Like she would go all day without eating, or would say, oh, I go to sleep like 3 or 4 hours a night. This is not healthy. So doing all these kind of things is just really setting us up to have, like, not taking your care of ourselves. And we can definitely talk about self-care, but not having really great self-care is really starting to set us up to have not really good physical health care either.
Neosha.
Um, okay, so my students get on me all the time about how I have an episode or a TV show or a movie for every situation. And in this case, I think about the Grey's Anatomy episode when Dr. Bailey was having a heart attack and nobody believed her. They were like, your numbers don't look elevated. We're looking at the squiggly line paper, with all this stuff. And no, and she's looking at them like, I am the chief of surgery at this hospital, at a different hospital across town. Y'all know I know what I'm talking about. So why aren't, and these were primarily white men, white male doctors that were looking at, the information, but she's telling them I'm having a heart attack. And that was my first time. And Sora Monica, like, I would love to pick your brain about this, all these things I see in media and TV shows after I was diagnosed. Y'all, it's not by coincidence that after 2016, we started seeing more representation, in more inclusivity, and a lot of that is a lot of just, surface stuff. But then also, even the deodorant changed after I was diagnosed. I said, oh, now y'all want to change stuff after I have a lump in my armpit. And so I start to see all these different images in different TV shows and movies. And I'm like, wow, where was this, before I got sick? But I know they say that stress is a silent killer for Black women. And they say that, the stress leads to aneurysms and heart attacks and things like that. So, I mean, I'm not a clinician, but I am a researcher. And I love watching something on TV. And it's just amazing to me how we see this in actual news, and then it's ripped from the headlines and it ends up in somebody's script. So I just think that we don't look at it just for entertainment. You can learn a lot from that stuff.
Can I just ask Dr. Shelton, are you taking any clients right now? Because everything, everything you were saying was speaking to me directly. And honestly, like, I know all the things. Like, I know that, I need to slow down and prioritize eating and all that, but it's so difficult. Like, if you're trying to climb the corporate ladder and you're taking care of a kid and you're trying to pay your bills and pay your mortgage and all that, it's kind of difficult just to sit and prioritize yourself. So just being a professional, I think a lot of us on this call can relate. Just being a professional is kind of hard to just sit and, take care of yourself. And I saw this really interesting, I don't know if it was like a TikTok or Instagram or whatever, I can't remember what it was. And I really had to sit with it, because in the video, the young lady mentioned that she realized she was doing everything fast. Like when she got up, she make her bed fast. When she got to make her coffee, like she was doing everything fast. And then something clicked to her where she was like, why am I doing everything fast? Like, let me take my time. Like, let me take my time to make my bed. Let me take my time to get downstairs. Let me just take my time. And every time I feel like I'm starting to do something fast, I think back to that video and I'm like, slow down. Like, you don't have to speed. Like, this is not a race. You don't have to speed to do this thing. Just slow down.
So Taylarr, I liked you shared that because that's what I'm currently struggling with and what I've noticed. And so let's talk about the other side of this. When Black women do start slowing down and advocating, it pisses people off.
Mm-hmm.
So that kind of emotional, you have to, I guess, decondition yourself to want to fix everyone else and be okay with people being upset. So why is this patient being repetitive, right? Why am I telling my family member no, that I'm tired, that I need to sleep in? Why am I think I've had people email and they literally expecting a response the next day. Like it'll be something where I need to like actually sit or may I have to teach or I'm tired. So I consciously cut my day off. I will get to you the next day. And it pisses people off. Something as simple as that. And so I would say, look, are you taking people to Dr. Shelton? Because what's the script here? Put it in the chat, please, or let me know your website, because how do you deal with that part? Because I think that is keeping us in this cycle too. The expectations of everyone else, and then they sometimes can get violent when a Black woman does advocate for themselves. And so that's not the direct conversation here, but I think that's also a secondary or tertiary issue here.
It really is about boundaries, and boundaries are not easy to implement. They really, and we can talk about the layered part about that. But in Christine Platt's book, what I've read so far, she talks about this thing of like how she doesn't know a single Black woman who is not in charge of something. All of us have something that we are managing or that we're in charge of. Just all of us really are. And I think back about my mother. My mother, it's been 30 years now. She's passed away. She had cervical cancer. And my mother was a teacher and she was involved in the community and she taught sacrament classes at our school. But like she didn't go to the doctor, because she was doing so many things for so many other people. And this is such a common story that we're too busy to even have self-care for ourselves. There are so many different resources I can recommend, and I'll put something in the chat about boundaries. And I know Dr. Kamek, we probably even will talk about boundaries, but I try to tell people because people be like, well, I'm too busy to take a break. And I'm like, can you do like 5 minutes in the morning, 5 minutes in the noon, and 5 minutes in the afternoon? Like that, you just label in your mind, this is my break and this is my time when I'm not going to look at my phone. I'm going to stare out the window, or like even, can you just have a moment before you go in the house that you sit in the car and you listen to your favorite song and you're like, okay, all day long I've been waiting to sit in my car and just listen to my favorite song. This is my self-care moment. There has to be something, because what's going to happen to you eventually, you're not taking a break, but your body is going to take a break because you're not doing it. And so if and I can be very honest and just transparent with you, just dealing with metastatic breast cancer, the role that I had in my family was much more prominent. I used to do so many more things before, but now, my body has taken a break and I've had to slow down a lot. So that's what I would just say, like we have to do it before our body tells us. But I will give my email, and if anyone wants to share my email about new client inquiries, I'll put that in the chat right now. And also, I'm going to put a book recommendation in the chat too that I think might be helpful for.
And I just want to add to this because this is my like super passion. A few years ago, I just started this whole thing, don't call me a strong Black woman, because when people give you that label, they stop seeing you as human and they want you to do something that's outside of what you're saying I'm capable or have the capacity to do right now. And it's like, well, this is easy for you. You always do this. You handle all of these things, but they never stop to ask at what cost. And the thing that Black women have to remember is it comes with the cost. Yes, you can do all the things. Yes, you can work extra. Yes, you cannot get sleep. Yes, you cannot go to the doctor, and it's killing us. It's literally killing us. So, as a Black woman, and I'm speaking to us specifically, we have to shift the narrative of how we see and define strong and strength. And it's not based on killing ourselves for anyone else or anything else. And the other part that we have to do as a community is when someone is saying, I'm not checking that email right now. I can't respond to that text message until tomorrow or whenever I have capacity. Or when someone says, I need help, it is not our job to say, you got it. You're so strong. No, that's invalidating. If someone is coming to you saying, I need help, we have to make sure we're offering a space to be able to honor that and support that. So, something that has helped me, and I also am a yogi. I just finished my yoga teacher training. But part of why I love yoga and meditation is that it requires you to slow down. And as a community, we have to slow down. So, Taylarr, as you mentioned, like moving fast and going through everything and zipping and doing this and this and this and that. And we don't have time to listen to what is happening in our body. And one of the things we know for sure is that our bodies are always communicating to us. It's telling us when we need to rest. It's telling us when something isn't right. But sometimes we move so fast that we don't hear it. And so if you can do little things like Dr. Shelton said, taking 5 minutes just to check in with yourself, attempting meditation. Some people say, oh, it doesn't work. It's like, well, the first time is not going to work, but you have to keep doing it. And sometimes it might be just a few minutes or a few seconds of quiet. Sometimes you can try guided meditations. You can do mindfulness activities where you're taking a walk and you're taking in the environment around you. What do you see? What do you hear? What do you smell? What could you touch? Because part of it is we need to be present and in the moment. And the more we're able to do that, the better we're able to do that and listen to our bodies. So the slowdown is most certainly on us as well. And I see some things in the chat about gardening, which is very grounding, by the way. And I would encourage you to also look at some of those ancestral practices or things that our ancestors did that were very grounding as well. So you think about gardening, you think about drumming and music and singing. You can create playlists that literally has if you want to be happy, if you're having a difficult day, you can think about what you're taking in from social media and being mindful of the accounts you follow. You can also be, and in a time like this where the news cycle is what the news cycle is, be mindful of what you're taking in with that as well. So I just had to jump in there because this is my passion as well. And then I see, and the other thing we'll do is we'll send out, I see that you all are putting resources in the chat. We will send these out with the evaluation from today as well. Are there additional questions? Please add it to the chat. I see we're coming down to the end. It went by so fast. So I do want to ask the panelists, like, as we think about moving from this awareness to action, what are some things that we should be prioritizing right now to improve our health outcomes and continuing to advance our health and wellness?
I'll go first so I can listen to everybody else. I'll say, the 92% isn't a lie. I think we're in a very unique place in American history. And so I would say it is responsible spiritually to also slow down and to not take it all in and to listen to yourself and to understand we're also moving through history at this time. And every institution is being impacted by it. And so I would even say the crisis is this moment right now. And so resting looks a certain way for the Black community right now. And so be mindful of that, to be intentional about finding joy every day and balancing what you take in and balancing what's energetically going on with this country every day, right? And so finding pleasure. I'm all about pleasure and play and the arts and whatever that looks like for you, and rest, but also it's bigger than us. culturally and historically, we're living through this moment together. So let's all take care of each other, have empathy, be kind. And that will have residual effects on our health and well-being.
I'd also add to that, prioritize community. No matter what season you're going through in your life, community is so important. Make sure you have a good village around you. When I had my child in 2024, I had just such the postpartum. That's something I never want to experience again. So much so that I don't want to have any more children. Um, Community was so important for me during that time and even afterwards, and still to this day. My child is 21 months old. I'm very fortunate that I don't have to put him in daycare right now because I have this community of people around me where I don't need that at this moment. Um, Again, as I was mentioning with, being a professional and, having all these responsibilities, I learned early on that I have to lean on my community at sometimes. And me being a type A individual, a Virgo, or oldest daughter, that came unnatural to me. I was very hyper independent for a long time before I had my son, and learning that I had to really just build that community around me was very helpful in many facets of my life, not just raising my son, but just needing to, debrief with a friend or, ask for advice or whatever it is. Having community around you and those that you trust is paramount, especially when it comes to your health.
I'll go next. So I wrote down some things. Touch your boobs. They're yours. You grew them yourself. Touch them. Check them on the first. Touching my boobs saved my life. Full stop. I was HER2 positive, which is an aggressive form of breast cancer. And thank God I was ERPR negative, which is hormone negative. But because I was HER2 positive and I had one positive lymph node in my armpit, had I ignored that, no telling where I would be, if I would even be here, right? So touch your boobs, especially if you're under 40, unfortunately, and advocate for a 3D mammogram. But another thing is listen to your body. How they say God's trying to tell you something. Sometimes God's speaking through your body. So listen to your body. If you're losing your hair, if you notice weight changes, or if you notice you're getting headaches more often than usual, things like that. Again, I'm not a clinician, but I feel like I have a PhD in cancer at this point, and that's something that a lot of people ignore. I lost a cousin to an aneurysm a month ago because he never went to the doctor and he did not listen to his body because he had been getting headaches. Talk to your parents and siblings about health. About their health. Let me be clear. Someone put in the chat earlier about, talking about, the family history and things that someone's mother-in-law, they had to do an autopsy to find out stuff about their family. And that just broke my heart reading that because, and I know we had gone on to another thing, so I don't want to bring it up till now, but I just think about, how my mom doesn't want to talk about anything and she tries to like ignore it. And my dad's open to anything and everything, but my mom isn't. And I'm just like, y'all are killing me here. Like, y'all need to talk to each other about things. And then when I call or I visit, you know, um, also my younger sister, she's 13 months younger than me, but she's still diabetes, type 2 diabetes, doesn't take care of herself, just had a bulging disc removed from her back in October. So I have to now stay on top of her about her health care. So don't be afraid to talk to your family. It can be scary, especially if your parents are aging and you don't want to embarrass them. But I say push through and embarrass them a little bit.
Um, and Dr. Kamek, I'll just say, from what I've even gathered from what we're talking about today, let's just try to be present. It's so hard for us to try to do this because it's like, after this, we got to do this, we got to do that, we got to do that, we got to, oh, slow down, just take it easy. Like, let's just be present. Let's try to enjoy things. I say professionally as a counselor, I try to work with people to be present. But then as a person just dealing with metastatic breast cancer, I try to be present. Every day is a gift. Experience it, just take your life one day at a time. It's perfectly okay to do that. It's fine.
And I know we're at time, but I see there's some questions. So I'm going to just pull up a few. One that was really good is, what's your advice for someone who is new to adulting and looking for a primary care physician?
I think I put a response in there. I think you be your own artist, right? So build your custom care team. Find you a therapist you resonate with. I remember when I first got to Clark Atlanta, I found a OBGYN. I still go to her, right? And I'm not 19 anymore. Okay. I'm in a certain stage of life, and this they have all my records. They delivered my baby, but their bedside manner is just something that I've never been able to replicate. I mean, I'm sure there are many, but I've never had to look. But think about a dentist. Find you a dentist that you love. So be your own artist with your care team. And so you know what you need, nutritionist. I don't know if there are any specific ailments you may have, but also those niche experts. And it could be holistic care. I think, Dr. Kamek said she's a yoga instructor. So maybe a part of your care team is someone that teaches you to sit in your body somatically, right? And so think of yourself as an artist. You get to build your own care team. And you have people here on this call that, if you have questions, please reach out to maybe older folks that you may trust. But also, as the other panelists have said, trust your body and how you feel when you're actually at the bedside manner of the people that you are engaging with. So if someone doesn't make you feel comfortable, it's okay not to go back. It's okay to send your evaluation. It's okay to find a new provider. And the tricky thing in America is insurance sometimes can just complicate that relationship, but you have to fight for yourself. And so some providers who are there about liberation and there about healing, they will ask if there is maybe a gap in care or ways around it. And sometimes they'll do a sliding scale, or you have a lot of community health centers, very qualified health centers, dentists who do community days. So be an artist and create your own care team.
I would also say to that, as Dr. Ponder mentioned, ask your friends and family who they go to. If you seem to find someone that you really like, check them out thoroughly. Check their health grades. There are a lot of websites that will grade doctors. They'll do like a 5-star scale situation. Check their bios and see if there's anything in their bio that resonates to you. A lot of doctors have their bios online. See if, they have any hobbies that, y'all share hobbies or anything like that. Do your research on them. Again, if you don't like a doctor, you do not have to keep going to them. Find someone else. I know it's really tough with an overwhelmed health system because a lot of great doctors, their client lists are full. Unfortunately, they're not taking additional clients, and that is quite unfortunate. But just keep trying. I think ZocDoc is a really good platform to build that care team. So, they have it, listed out where you got your optometrist and, your primary care physician, your OBGYN and all that. And you can build your care team there so that it's like an easy list to see and you can see their grades and their bios and all that. But yeah, definitely just ask around. I would say ask around first and then check out their health grades online.
And one last question. Are there certain questions or phrases we should keep in mind to ask our providers in order to better advocate for ourselves if we feel that our concerns are not being taken seriously during an appointment?
See, when Oprah had her magazine, she had a foldout in the middle of her magazine that you could take and ask, and it was questions, common questions to ask your doctor. And it was great, and everything like that. And, it was helpful, and you could just rip it on right on out the magazine and take it with you and everything. But I think that you can definitely think about it, but also too, I would also say, think about, is there anyone that you can bring with you who can ask these questions if you feel uncomfortable asking them? Because then, that will help you. That will make you feel supported. That will make you feel, because some of them are really important, especially like, yeah, about your prognosis. Even people have told me they've been scared to ask questions about their medication management, about these type of things. So I would say, if you feel like you're unable to, ask the questions, maybe two things, maybe can you find someone to bring with you to ask the questions? If not, can you find someone to role play with you asking those questions? And then also ask that person to collaborate with you on questions that you want to have. But either way, have the questions really written down so that you don't forget.
My biological father was a cancer survivor, and he is part of the reason why the book's called God's Got Jokes is because he passed away like 2 weeks before I started chemo. But one of the first things he told me was to take a notebook to every doctor's appointment. And that was like the best thing he could have ever said. And mind you, this is before everybody was using the Notes app, y'all. It's sad how fast technology changes in 10 years, but I wasn't thinking about a Notes app or voice notes. I don't think they had voice notes in 2016. And him telling me that it really shifted my mindset because I always take notes. Like I have notes here, take notes in church, class, whatever. And I never took a notebook to a doctor's appointment in my life before I was diagnosed. And also, there's nothing wrong with asking the doctor to record the meeting, your appointment, so you can circle back on some questions that may be something you didn't hear. And that's something I tell patients, cancer patients all the time, is if you have to download Otter and record, do it. If you need a transcription service, or something, if that'll help you, because you don't want to miss something vital, when you go to the next appointment. And I mean, like the other specialist or whatever. So, but yeah, I think it's important to have somebody with you if you can. My best friend would drive from Baltimore down here for my doctor's appointments when I was first diagnosed. And I was forever grateful for that, even though I had a breast navigator, and he still would drive down so he could understand because he's my um, emergency contact. He knows all my directive stuff. So yeah. Oh my gosh, yes. Chemo brain is real. It's so real, yeah.
Well, thank you all so much. I do want to give our panelists this. First, I just want to say thank you because this has been a very enlightening discussion. I was over here taking notes myself, just in terms of finding the value of how do we advocate for ourselves, taking notes during appointments, asking about recording, having someone in this room with you. But then there's also value to us having these discussions in our friend groups with our family members so that we can recognize, like, who are you going to for certain things? And also, you may learn something new that you can ask and a doctor's appointment. So I appreciate all that you all added to this conversation tonight. I hope that you all that attended were able to get some useful information as well. To our panelists, if people want to follow up with you, what are the best ways for them to contact you or reach out to you or find you for more information?
I will put my information in the chat. My email is tlopez@nmqf.org. But I will add the information to the chat for you all.
And I just want to just come on and just say thank you. This hour went by way, way, way too quick. But I think you touched upon the things that were on people's hearts. And I really appreciate your honesty, your open candor, and being real. Like, I think all of us have our own stories. And I think sometimes stopping and having that conversation, because I was sitting there like, yep, that's me. Yeah, that's me. Yeah, 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 yeah. That's me. But understanding that it's important that we have these conversations, we think about our health in a systematic way and think about how we change our communities. And sometimes people get on here and I've been to discussions where people are very clinical and you seem very disconnected and I don't understand what you're saying or you're a lot of statistics and not being real. So I appreciate that you made it very accessible, that you opened and shared your life and your stories with us. And with Delta, we'll ask you back like 6, 7, 8 more, 10 times. So uh, thank you in advance for always coming back. And thank you, Source. That
And
wasn't on the agenda. I just jumped in. Sorry.
no, that was perfect. And the last thing I want to add is we did put a link in the chat for evaluation. So if you can please fill that out, that is how we know like what programs, future programming the community may want as well. And then on May 16th, we are having a community day health fair at Sycamore and Oak. This is our second time having this event, and we want to be with the community. And so if you are available, please come out. That link is in the chat as well. Please share it with your networks, because as we're talking about health, one of the things that I learned from our health fair last year is that health fairs are a part of some people's health care. And so we have been very intentional this year about having people for dental health, mental health, physical health, doing screenings and annual screenings and all of the things, because we really do want to make an impact in the community. And so that information is in the chat. I appreciate all
And
of
it's
you.
free.
And it's free. It is free. So we will, and if you have children as well or know of children in the community, we will have things such as the Colgate van doing dental screenings. LabCorp will be doing medical workups or blood work for people. We will have blood pressure and all of the things, and it's all free and for the community. And so we don't just want to talk about these things. We do want to think about how are we making healthcare accessible to the community. I will put the link in the chat again. I see a question. And so, there we go. And so again, thank you all on behalf of the Washington, D.C. Alumni Chapter of Delta Sigma Theta Sorority Incorporated, our chapter president, Nicole Jordan, the Journey to Wellness Committee, of which I am chair, and my co-chair, Anaya Relaford. Thank you all. We appreciate you, and good night.
Have a great evening, everyone.
Thank you for having us.
Thank